It appears as though there is a Kentucky hospital emergency room placed on lockdown. Nobody knows really what's going on. This is the latest report, and it's been well over a few hours. The actual instance or what is causing such a lockdown is unknown. I find that really hard to believe. There is something major going on in Kentucky, but nobody wants to tell us what's going on. How typical is this? This could be a case of Ebola, it could be a case of something else, so on and so forth, but yet we are left in the dark on this. This is bull. They need to release information as to all of what they have, not just give us a crap statement saying they don't know what it is. And here, in fact, I'll read the whole thing for you. A spokeswoman for Kentucky's health department says a patient being treated for an undisclosed illness at a hospital is not believed to pose a risk to the public's health. Then if it's not going to pose a risk, tell everybody what the illness is. That's what I don't understand. Is if it's not going to pose a risk, then tell everybody what it is. This is just not fair, honestly, because I'm wondering what it is. I really am. It's bugging me. The emergency room at Ephraim McDowell Regional Medical Center in Danville was locked down Saturday at the hospital evaluated a patient for what officials called a potential public health risk. Hospital spokesman Jeremy Kokenhauer said Saturday afternoon the hospital did not have definitive information that would either rule in or rule out that there is a risk to the community. He did not disclose the nature of the illness or the identity of the patient. Later Saturday, Gwenda Bond, spokeswoman for the Kentucky Cabinet for Health and Family Services, said the patient likely does not pose a threat to the public. If there is no threat, then why not disclose what the illness is, unless they are worried about panic, which means that there is a potential risk. They wouldn't put a whole entire emergency room on lockdown with caution tape outside the hospital if there was no risk or no health threat, whatever. It could be nothing, honestly. It could literally be nothing, and it's just a drill, a temporary practice or whatever to see how fast hospitals can go on lockdown in Kentucky. But it just doesn't make sense. In a statement, the hospital said it was working with the state and local health officials and coordinating with the Centers for Disease Control and Prevention. Patients were redirected to other emergency rooms in the area. CDC spokeswoman Bernadette Burden told CBS affiliate WKYT the center received a call from the state health department seeking help on Saturday. She said the CDC is providing technical assistance to the hospital. Danville Police Chief Tony Gray told the Lexington Herald-Leader that the emergency room was put on lockdown because a woman has a condition that the ER staff is not really sure what it is, so they're just taking precautions. Not really sure of what it is, but yet they have an idea that it poses a health risk. If they have an idea of what it is, why aren't they stating it? The woman had apparently been overseas recently but has been isolated, Gray said. He did not know her symptoms. Now this is getting interesting, isn't it? Anyways, that's all I got on this particular bit of news. I want to thank you all for watching. Please check out the websites intelrevolution.com and socialexodus.net. God bless and carry on.